Thank you, Professor Bakari. Thank you, all invitees. Protocol has been observed. I have been introduced. My name is Eveline Maziku from the Ministry of Health, National AIDS Control Program. So that is the presentation outline. I will speak a little bit about the AGY HIV situation, current AGY program that we have, service delivery package and the activities, success and achievement, but also barriers and the next step. Tanzania has been decreased the HIV infection in general population from 95,000 in 2010 to 54,000 in 2021. So you can see there is an improvement, but still there is a slow decline that has been observed to AGY, adolescent girls and young women, marking them as priority population for HIV prevention efforts. For the data of last year, 2022, the new HIV cases among AGY 15 to 24 were 11,448 for that year, and 5,148 to the AGY of 10 to 19 years as per last year data. It is also estimated that 115,324 for AGY of 15 to 24 years and 53,986 for AGY of 10 to 19 are living with HIV. Among them, only 10% for AGY of 15 to 24 have suppressed their viral load, while 7% for AGY of 10 to 19 has also suppressed the viral load. You can see there is still a challenge on suppressing the viral load among those group. The current slide shows the UN AIDS target, which is 95-95. I think all of us, we are aware of that target. And you can see to the AGY, the blue color is for the AGY of 10 to 19. You can see only 66% who they are knowledgeable with their status, and only 73% for the AGY of 15 to 24 who know their status. For the second 95, you can see it's going well, but another challenge is on the third 95, where there are still not all AGY who has suppressed their viral load. And this makes them easier to infect others. As we know, the AGY among the vulnerable population, that's the area that needs more work. The government works and strategies. We have different national strategies that guides the HIV prevention, and more strategy or more emphasis of the HIV prevention strategy for Tanzania mainland is to bring full-scale proven and the prioritization of combination HIV prevention intervention that addresses the drivers of the epidemic. We know AGY, there are vulnerable AGY who are also among the key and vulnerable population who are the drivers of HIV epidemic. So as the country, the national strategy is to make sure that we prioritize combination HIV prevention. When the AGY is at the facility or meet with the health facility, we make sure they got all the combined health services, structural, biomedical, so that they don't miss any. As I said, we have this combination prevention, so these are the framework, making sure that AGY, they get the biomedical. On biomedical, there is a sexual education, PrEP, and the HTS, differentiated service for testing. So all that are under biomedical, but when you come for the issue of behavioral, there is condom, behavior change intervention, so that they have their tendency or routine of utilizing the health service, but also structural. As we know, there are still issue of gender-based violence, which have become the barrier in HIV services. As I've said, we have different programs. The slide there shows the program that we have in the country. We have Timiza Malengo under the Global Fund. We have Dreams, we have Keshi Plus, and UNICEF. So all these are the programs with the main goal of creating awareness of HIV service, reducing pregnancy, STI, retaining of the AGY to school, and the other special issue regarding to AGY. Timiza Malengo, they have five regions. You can see on the map there. The challenge, this program are not scaled up within the country due to the shortage of the funds. So we have prioritized the few regions. You can see under Global Fund, the Timiza Malengo are implemented only in five regions with the 12 councils. So total these programs have been implemented in only 32 regions, 10 regions and 32 councils. So it's that we are expecting this year under this COP22. We'll continue negotiating, discussing with the CDC, PEF, or Global Fund in making sure we extend this program so that all the regions are being covered with this program. This is Timiza Malengo. It shows the entry point. How do we get that vulnerable AGY so that they can be involved in the program? These are the regions for Dreams. As I said, we have Dreams, we have Timiza Malengo. You can see Dreams is on the also 5 regions with the 14 councils. So still as the government, we have gaps, not all regions that are covered with these programs. But this is not the reason of not implementing. With the government effort, even other regions that doesn't have this program, they are getting this service, although it's not that much as to the regions with these programs. This is a service of package, shows at the age of 10 to 14, this AGY, which service are they supported to get. Same to the AGY of 15 to 24. What service are mandatory to be saved to AGY? So all this, the direction that helps even the IP partner who works with the government, making sure that we follow the guideline, so that we want to go against the agreed guideline and the policy of the government. Here the success, you can see there is an increase uptake of age-wise service. So through these programs, you may find many age-wise have been involved and connected to the health facilities. So all this helps them to know their HIV status. Also the introduction of new HIV prevention technologies, scale up of health education to schools, parental engagement. Parents have been engaged, and most of parents have been give testimony that their adolescent girls have changed behavior and now retained in school. So all this are the achievements. But above all, integration of male sex partner have been involved to the service through age-wise. We have barriers and challenges. As we have seen to the cascade there, still this group, still not all who knows their HIV status. So we need to continue efficacy identification in making sure that all age-wise they know their status, and this will prevent new HIV infection. But also suboptimal coverage. As I said, this program are not in the countrywide. There are some areas where there is no this program. Linkage into HIV service, STI cost, partner coordination. As I said, some of partners are not faithful. They don't follow the guideline. You can find we have the vulnerability index tool to know who age-wise are vulnerable to this service. But sometimes you may find the partners, they just want to target. So even those who are not on the vulnerable, they are involved. So this is among the challenge, but as a ministry, we are working on it, and the situation is now good. Inadequate engagement of age-wise in the program. The young age-wise there, the first presenter have mentioned about this, that most of the age-wise are not involved. It's true, but through this program have helped a lot to making sure most of the age-wise are involved in their programs. Next step, we are still in discussion with the PEFA and the Global Fund. This year is the third year of the GF grant, and we are going to write another request. So one of our aim is to making sure we expand the regions for the support, to expand the regions for dreams, regions for Timiza Malengo, so that all the regions or all age-wise they benefit with the programs. These are the implementing partner working with the government on age-wise. You can see there is PEFA, USAID, the Ministry of Health, we have NASPO, RSH, we have UNICEF, FHI, and the other. Thank you for listening. Yeah, asante sana.